Okay, well, welcome to the webinar today from the part of the local drug action team for discussing the community action plan. And as we get started for the webinar, I'd just like to acknowledge the traditional owners of the land which we meet today, the Wurundjeri people, members of the Kulin Nation, and pay my respects to elders past, present and future, and acknowledge any Indigenous people who are on the webinar today. So. We have reached a really exciting time within the LDAT program. My name's Alan Murphy and I'm the Head of Program Delivery here at the Alcohol and Drug Foundation. And with me I have Melinda Lucas, who's our Knowledge and Research Manager, and I'm also going to be part of this webinar for us today. So the webinar today, as we get into what the community action plan looks like, as I mentioned, the exciting part about the work is that we currently have 80 LDATs within the program, or LDATs as we call everyone now, the local drug action teams. There's 80 across the country, and we're at the stage, and it's just after 12 months since we launched the first 40. And we're at the stage where we're getting close to the announcement of the next round, the round 3 groups coming into the program. So we look forward to that announcement over the next couple of weeks. And as part of that and part of the development, we've reached a level of the resources that we now have available. So we know that our local drug action teams are working closely with relationship managers across the country. And the exciting part now is that we're actually producing some tools that support that toolkits, and example of that being the community action plan that we'll talk about today. So I think that's a really exciting time for us, and something that will help both from our relationship managers and LDATs to work through the steps of the process and to continue to build evidence-based approaches around reducing alcohol and other drug issues in our communities. So the other part that we'll note is that as part of our development, we've also then started to put these resources on our website, and if we look at the community hub page, so if you go to the ADF website and then into the local drug action team page, you'll actually find these resources now present, and we've streamlined the way that the information is presented there, so it's much easier to find the tools and the resources. So the other part to consider with the way we've developed the resources to this stage, the actual community action plan is now a key part to how we complete one aspect of the planning, and then we actually move into projects that are part of the community action plan. And so on your screens now you'll see that we've currently opened the grant round, which we know that I guess that the groups, the LDATs that came in 12 months ago, and now most of those groups are moving towards the end of that funding round, and are now looking in some cases for more funding, and others have found other sources of income. But we know that there's an eagerness and people working towards completing their community action plan so that they can be eligible for that funding. So you'll see there that we also then have a date there on the 7th of May where we'll actually pick up whatever applications have come through the process to this point, and assess those and notify LDATs by the end of May, the 28th of May, as to funding available in the next phase for those groups. So the other important change we've made now is where previously there was a short time period for the grant allocations twice a year. We've actually now moved into a rolling grant round. So essentially the grants are open at any point in time. You'll be able to work with your relationship manager to actually work through your community action plan, and when that's submitted, then open the opportunity for further funding. And so we will continue to assess those on a regular basis and then allocate funding. So it's no longer limited to certain time periods. So if, for example, you're been in the round 1 of the LDAT program and been working for a year on a project, and you needed to extend the time period that you have of working on that project, then you may actually now look to seek more funding in June or July or August. So there's no limit as to when you can come through that, and not the same restrictions that were there earlier. So it makes it much easier to really progress through the stages when you're ready, and working through those expectations and opportunities with your relationship manager, and the information we provide. And the other really strong part about that will be how it links then into your community action plan and the tools and resources, which are all about evidence-based practice, and how we actually strengthen that opportunity for you to connect into those and build the understanding of how to apply that evidence-based practice into different local communities. So look forward to that. So just then looking on your screen, you'll see again the way we've now progressed to simplify the way we describe what the local drug action team program is all about. So you actually obviously already in the program, so you've been through the first couple of stages that's described on there, which is really where the question is the program right for us? Because we've seen, like with many different programs, it's trying to just make sure it aligns with your intent, and we know this program's not around treatment services and other areas, it's more around prevention. So it's looking at the questions around what are the issues locally, are we looking to create a prevention-based approach to that work. Then in coming in and joining the program, you would then link with our staff at the ADF to then go through the application process. And again, we've already been through that process here, but as new groups are coming through, then they're now actually working with our staff to connect in that. Then the other stages are to develop the action plan, which we'll talk about today, to implement the plan and to evaluate and measure the success of that, and then continue that cycle of building and refining your plan and moving into more projects. So we'll find from that the resources will actually then be much more applicable and aligned to those expectations. So just to then make reference to where will you find the resources today, you'll see a web link there, which takes you then directly to the information where you'll be able to download today's resources and work your way through that. But obviously your relationship manager will be able to support you through that stage as well.
That's just a bit of a guide of once you hit onto that link, Alan, that you'll get to the planning stage, and all the 4 parts or 5 parts that I'll talk about today are broken down as individual aspects within there for people to be able to access quite easily and really straightforward with all the steps. So I'll pick it up from there. Thanks Al, that's a great, and the program itself has evolved so quickly over the last year and a bit, and we've seen some really amazing projects, and we're really excited about bringing the new lot of LDATs into the program as we move forward, with that key aim of recognising the power of community and the power of primary prevention as we move forward into really reducing the harms associated with alcohol and other drugs within the community. One of the key things that we've been working on is to develop these tools to really assess or help to LDATs who are joining the program, and also to strengthen some of the LDATs that are already in and recognise the great work that they've done in moving forward through the process. And then at the end, I'll also talk about some of the other resources that that are currently ready to go, and certainly in development as well, to support the work that communities are doing within this space. So the first tool that you'll come across when you log into that previous link will be about identifying the alcohol and drug issues within the communities. Now, a number of communities will have already done this, and they will have done it really effectively, but it's such an essential part of the program, so that the really important part about this is we actually have to ask people and identify them, because what one person may see as a key issue in their community may not necessarily link with what the next person is. And that's why, again, strengthening communities and having a community voice means that you know what's best for your local region, for your local community, and certainly what ranks as the highest concern. Interestingly enough, when you start doing that, often what you'll find is that what falls out as a picture of your local need might actually be a little bit different to what you first expected. And we've seen that with a number of LDATs already. And the power of that process means that you really then do build your accurate picture, you gather your local data, and you can clearly identify what your priority issue is within that. So the first tool that we have, a step-by-step guide that you'll see on the website, really supports communities to do that, particularly that local data. Sometimes the word data can be a bit overwhelming for people, unless you're a data nerd like a number of our colleagues are here. Having the guidance and the support to be able to know what's relevant and what's not relevant, what is relevant for your issue and what's not relevant for your issue, and how to read that and then interpret it and then apply it into your community is a really essential part of that tool, identify your need. Once you've gone into that and you've recognised it, you can then start building your picture, and you've got this great foundation to where to build the rest of your LDAT and the rest of your community support. Part of the idea of the program is that this is a long-term community response. So even when you come to the end of your project with this, you've already established what your need is, you've established your local data, and so you can use that information to do a whole bunch of other things, and not necessarily related to the ADF's LDAT program, but in building that community response and building the strengths about reducing alcohol and other drug harms appropriately and effectively within your community. So the benefit outweighs any data issues that you may have. I promise you it won't be that hard, and you've got the support of the ADF in that initial phase to be able to know how to gather it, what you're looking for, and what is relevant and what's not relevant, and we're here to help with all of those processes. The second one of that builds pretty much into what I've just talked about with that community consultation, and getting a clear picture of who and who to consult with and how to consult within communities. Again, a number of the LDATs who have been with us from the start have done really amazing work with this, and we've seen community groups come together that have been a little bit outside the box of what we would often consider to be within these types of organisations. Often we'll, in an LDAT that works in the health space like this, we'll immediately think of education facilities, we'll think about health centres and community health centres, and particularly because we have a lot of youth in there, we'll think about youth organisations. But some of the more sort of outside of the box ones that we've come across will be engaging with your local, the Justice Department. Often that will be the opposite end of what we're doing with primary prevention, but what you can gain in the insight from working with the Justice Department means that you get a really great spectrum about it, and often they will have really good insight in terms of how people who ended up with them, what was their backstory, and that's what we're looking at addressing with our primary prevention. So it's a really relevant partner to have a partnership with. Another example of that would be your Chamber of Commerce. So we have had a number of LDATs who, as part of their community consultation, have managed to talk about the broader picture, because we know, again, looking at primary prevention, our risk and protective factors, one of our key protective factors against alcohol and other drug harms is employment. And so if we address that at the core by our community consultation and what we find, and again, going back to tool 1, some of our data that we look at in terms of unemployment rates, that builds into the community consultation by having a conversation maybe with business members in your community that then manage to be able to become perhaps a part of your LDAT, not necessarily a formal partner, but certainly someone you can draw upon their skills to be able to be a part of what you are trying to do as a community response. Also embedded within that community consultation toolkit is just the important question about people's different views on drugs and alcohol. A diverse community means that people come from a diverse range of backgrounds, and one of the ways that we need to be, or one of the things that we need to consider within this is people's different views on drugs and alcohol. And by encouraging community consultation and asking people what are the key things that you need to do, and you listen and you try and understand and you respect the voices that come together, you can then again start to build that community cohesion. And so people then start to be able to understand what are the key issues, what are the facts, and how can we actually to ensure that we can look past the emotion of an issue, because it's a highly emotive area with alcohol and other drugs, and really get down to what can we do and what's the most relevant response, and how do we actually, one of the key things, how do we remove the stigma associated with alcohol and other drugs that might be preventing community responses, or people might have views that they've been formulated out of media reports that may not necessarily be the accurate for their communities. So that's a really important one. Certainly we have a number of existing LDATs who are working very closely with the media in terms of addressing some of that incorrect reporting. I think you've seen some of that, Al, too.
Yeah, it's part of the solution. So rather than creating extra hype through the media, we can actually use that process to reduce the amount of stigma and the amount of concern, community concern.
Yeah, and it's such an important part of the program. So moving on to tool 4, and this is the important part from now in terms of how we actually manage moving forward and what the LDATs will need to work with their community action plan. So now that we've gone through all those processes, we've established our partnerships, we know what our local community issue is, we know what our data is, now we actually decide this is what we're going to do. This is a project or activity that we've decided is the best fit for our community. And so we've developed a community action plan, and this, again, this has been simplified to make it a really clear and be really concise, I guess, in what you're doing, who you're hoping to work with, what is the priority group that or is there a priority group, or you're looking at your whole community response, what is the project that you've determined to be what you'd like to do, and then how you're going to do that, and then how you're going to measure your success of doing that. It's a relatively straightforward process, and the plan is that you will work with your relationship managers. You'll know your community best. Our relationship managers will be best to guide you through this process. But the idea is that when we get at the end of our community action plan, we have a really clear picture about what your community is going to address, how you're going to do it, how you're going to achieve any outcome, and how you're going to measure the impact. And ideally, that's going to be a very good impact. Just throwing it in here from the program itself, one of the really exciting things about the LDAT program is that a primary prevention approach like this hasn't really been developed or attempted anywhere globally. So by engaging with communities, and by us bringing the LDATs to be a broader nationwide community, we have the opportunity for the first time to really determine what does work in primary prevention space, and how can we actually strengthen that. So it's an exciting time in terms of global primary prevention, that at the end of this program we have a real opportunity to be putting forward ideas and research about what works, and that's a really exciting part, and it's something that all of us are going to be a part of, and hopefully setting the global standard. So we're setting our sights quite high, but
and I think more and more communities are realising that the next community or other communities are experiencing quite similar issues to their own.
That's
and
right.
So we don't all have to solve the same problems independently, and we're already seeing LDATs being able to share ideas and leverage off that. And so the more we can determine what is good practice, what is having an impact, then the stronger that connection will be. And that's why for us this is really important, and we're seeing people get excited about being able to measure that impact and know and be confident then that we can do more of that activity.
And the exciting part about being able to bring people together is that what we've already seen is that LDATs that are pre-existing based in the top reaches of Queensland have had conversations with those in New South Wales, and often those two groups, well, by virtue of distance, don't really have a communication. But when they realise that some of their issues, whilst they may be different priority groups or even different substance issues, the community response of one can be retrofitted into a different community. And so having those voices together to say, hey, we did this, that's a great idea, that might work for our community, again builds that overall practice about what will work and how do we be able to be change the nuance sometimes with communities, but essentially share the same climate prevention practices. And that's an exciting conversation to be had as a country as big as ours, to be able to have community groups from the top of Queensland having great conversations with community groups on the coast of New South Wales. That's a pretty hefty achievement, I think, from us. So I'll just do the measuring your success again. How we measure this is often, again, if people hear the words evaluation, it sends a shiver down a number of people's spines, because it can often lead to visions of spreadsheets and numbers, which some people love, other people less so. So we've actually designed this again to acknowledge that we do need to get the data, because without the data we can't actually ascertain what worked and what didn't work. But we're really supporting how you actually gather that data and what you actually do with it, both from a qualitative perspective and the numbers, the quantitative perspective as well. So once we do that, we can reflect on it, and then we can share your success with the rest of the community, and essentially we can share it like I said, we're thinking big. We can share these successes from a global perspective as well.
And I think where you see us developing toolkits, I look forward to when we're developing toolkits that are being produced by the work of our LDATs that actually demonstrate, well, what is the evidence-based approach, and how do we share those ideas in a consistent way across the country, and as you say, globally.
Yeah. So I'm just going to talk a little bit about the Community Action Plan. It's an appendix at the base of one of the overall guide I've just talked about. So, confirming your local issue. We've actually written on this plan a number of key issues that we've determined that a number of LDATs are already doing. It might be alcohol and pregnancy, it might be crystal methamphetamine, alcohol, cannabis use. It will be vary in different communities. And so getting a bit of a feel for what is your local issue within that community action plan, and then your target audience. Sometimes you may have more than one target audience, and sometimes you may be really specific. We certainly know that a vast percentage of the LDATs will be working with young people, which makes sense, because we get young people before they hopefully travel up that continuum of harm. So by asking you, who is your target audience, that's to help us determine what's the most appropriate response for that. And because we work very much and very strongly from an evidence-informed perspective, we've got great tools and resources that we'll be developing that will go along with both the issue that you have determined and your target audience, that we've done the hard work to go through the evidence and work out from what we know so far, what do we know works, more importantly, what do we know doesn't work. So rather than people going in and doing some projects that may or may not end up so great, we've been able to sift through some of that and say, it's a great idea, and explain why not necessarily it's a great idea in the end. So one of the things with the Community Action Plan is then being able to determine what your project will be. And this is the really key part of that. So this is how the work with your relationship manager will be really important about what you're going to do. So now you're at the point where you've got your LDAT, you've done a community consultation, this is what we're going to do. Here at the ADF, we've actually developed a number of key resources already, and will be more rolled out in the coming months. But hoping we'll preempted, well, not really preempted, because we've already got information from round 1 and round 2, areas of great concern that seem to be pretty much across the community. So we've developed a suite of, or we're referring to them as toolkits that people can pick and choose or take bits of information out of, or some communities may choose to pick up the whole toolkit and implement it as one. An example of one of the ones that will be available is on mentoring. So the evidence shows from a local and national and international perspective the power of a mentoring relationship, often between a younger adult and an older adult, or a young teenager and an older, often older adult or early 20s. And the relationship between that in that mentoring role. we've created a toolkit that addresses that, explains what mentoring is, and then steps you through a process of how your community may choose to run a mentoring program. And within that, we've acknowledged a number of mentoring programs that already exist, and some ways that you may be able to link into. But if not, here's some key ideas about how you may choose to do that within your community. And we have other ones based on education, because we know that education is fundamental in terms of, if you understand what's going on, you're better placed to be able to respond to it as a young person. We've done some on peer support, again, similar to mentoring, but this is more of an age appropriate, so it'll be young person to young person, being able to have that conversation on that level. And as we all know, going back to teenage years, often young people are often way more fun to talk to than old people. Yeah. So if we can skill up some of those young people to have a really strong voice in supporting their peers, that's often a great outcome, and certainly it's an evidence-informed approach.
And we know some of our LDATs are already working on peer support and mentoring programs.
Yeah. So again, we'll be encouraging LDATs to jump on it and use the resources that we've created, because if we're looking at building that big body of evidence by having people doing similar projects, that's determined by your community, and there'll be differences according to your community needs and what your community is made up of, means that that body of evidence that we know gets built up and stronger, and you can be part of the global evidence, and certainly we'll be asking for your help as we go through with this. Once you've done that, setting your objectives, which is part of how you're going to do it, how are you going to do it, what are you going to do, and again we step by that in the process, and the toolkits that's embedded in there. Any questions you have, your relationship manager will be able to support and guide you through how to actually implement and what they are, and then you map your steps. What am I going to do? Who am I going to consult with? How am I going to do this? And so managing and doing that will be about, they'll be the key things that you'll have written down. Some of the things you may have written down initially in your community action plan, you may find change as you go through it, and you go, you know what, that didn't work for our community, but this step will work for our community. And the way we've designed this is that that's certainly possible. We haven't designed anything to be, you are going to do it like this. The whole point is, here's an idea that we know works. We'd love you to be able to put it within your community and do it that way. And
you'll learn along the way. So I mean, in any scenario, you start with what you know and understand, and you keep building as you work through that. And I think that's the process. And again, for us, the more we can help strengthen the processes around that, the quicker you'll learn and learn from others as well as to what way to change and adapt programs along the way. Pieces of work.
Yeah, and that sort of, it'll be a dynamic process, and when you get to the end of your project and then you start measuring your success, with that you're going to be able to measure what worked, what didn't work, what can we change and what can we learn. And then when you go into the next project, you may do the same project and tweak it ever so slightly and build even more on what you've originally done. Or you might say, that one wasn't so great for our community, but we're going to try this different way instead. So the way that we've designed the resources to support the LDATs is very much with the community in mind about how they actually are going to work with the resources that we've created with that. Measuring your success, again, it really is about impact and outcome. What is the impact of that, and what is the outcome of that program? And it may just be that the outcome is that you've raised awareness, that people, and certainly if we think about the stigma one that a number of LDATs have done, it may be that you've contributed to the community conversation about removing some of the discrimination and stigma or myths. It's a bit of myth busting, really, isn't it? Yeah. And if you can do that as an LDAT, then you change the conversation ever so slightly in your community, which means that a number of things, people are better voiced, they understand the issues, and if you understand an issue, you can react and deal with it a little bit easier.
That's right. And sometimes it's about reducing the community alarm to community concern and awareness. And if it's that way, you can focus more then on what the actual problem-solving approach is, rather than perhaps taking some of the hardline measures that might come when there's a real concern about how big the problem seems to be. So when you actually break that down and get more community conversation, you understand where the issues are and then how you can actually deal with that. And that's a really important step. And that will come through the community consultation process as well.
So the community action plan, you will work, as I mentioned a few times, really closely with your relationship manager when you're filling those in, and the project and activity that you choose to do, again, determined by you, because the community is the best place to know what is right for their community. The ADF and the team are here to support that process, and we're building in the knowledge base of primary prevention within the community. Any questions?
Yes, I have one. Can the focus of the LDAT be on more than one issue, as in on more than one drug topic?
Definitely can. That's a great question. It can be, because there is not, a community is dynamic, so we don't just have the problem in one community being young people drinking too much, or methamphetamine, or cannabis. So definitely more than one issue is very appropriate.
Yeah. And I think it's also worth noting that it's not particular to one particular type of drug. So the way we work as a community around local drug action is actually trying to create, when you're looking at prevention, it's prevention across a range of issues that will impact on drug use, a range, whether it's alcohol or other drugs. So I think that's an important connection, that you can be looking at, well, what are the factors that cause the drug use or increase the likelihood of drug use, to actually be able to address that.
And with regards to mentoring, is there a list of existing youth mentoring programs that are already being delivered?
There are, yes. So within the mentoring toolkit, there are a number of pre-existing ones that we've had a look at, that an LDAT may choose to follow the link and the steps to learn how to actually leverage some of what's already there. So yes, definitely. And again, if other ones come up, because by all means we haven't listed everything that is appropriate, have that conversation with your relationship manager, and it's not designed to be, these are the only ones that may be appropriate. Certainly there will be others that will be more appropriate, and also in different cultural settings there may be other ones that we're not aware of, but can be very, very strong. So yeah.
I think it's also worth noting, just on that point, that we know in community organisations there's often evaluations completed on work, but you often don't have the resources to actually get that published.
That's right.
So we actually know that there's unpublished evidence that again, through this program we expect to pick up more of that, to get more of those examples of what is being demonstrated as good practice around mentoring and other work.
Definitely, and we have the opportunity to learn from LDATs. You'll say, hey, in our community we've run this mentoring program for 20 years and it's been really successful, and that's great feedback for us, because then we can share the principles of that program and share that, and maybe another LDAT with a similar community may choose to do the same thing. So it's a bit of a we will be relying a lot on what the community are also able to share with us about all of these toolkits.
Great, so I have one more question and then a comment. The comment relating to primary prevention, although an anonymous contributor says true primary prevention should impact on a number of issues within the target group.
Yep.
And another question that came up was, is involving community members worthwhile to strengthen your team?
Yes, definitely. Yeah.
And again, you'll find different reasons, and it can be hard to get people who are not connected to community organisations to come in as general community members, but it's worth that, because that actually gives you the true input and contribution from the community. So definitely worth it.
Yeah. For example, if you're wanting to work with young people, you really need to have a conversation with the young people in your community to be able to get a sense about what they feel is the most appropriate, what will work for them. Because again, if you've got a bunch of really well-intentioned and really well-resourced and professionals, but they're not young people, they may miss the mark a little bit. So having the community is absolutely essential in these. Yeah.
Another question, can you have a focus on preventing relapse?
I think that when we're looking at preventing relapse, we're dealing with an issue that's been at one end of the continuum, but we also, that's very much embedded within the primary prevention approach, because what may actually have put that person into drug misuse or alcohol misuse initially, we still need to consider what those factors are, because those factors will be fundamental in terms of how to prevent any relapse as well. So if we address what the key factors were that may have put that person into that risky situation with a primary prevention approach, that in itself will be a long way towards potentially helping support someone from relapsing.
That's all the questions I've got.
That's all the questions.
Great.
Terrific.
Thanks very much.
That's right. Just to mention, in conclusion, I'll just note again that the grants round is currently, well, essentially now it is rolling grants. So just to go back through that they'll always be open now, and we will continue to assess those. So if you're not quite ready, there's no need to rush from where you've seen now that the grant round's open. There's no need to rush. Just keep working through the community action plan, keep working through with your relationship manager what needs to be done, and then when everyone's agreed that it's ready for the next stage, then that's one way to progress through that. So we're really excited about how this is actually just becomes much more open and continuous for our LDATs to work through.
I do have a last question, although it might require some follow-up with our marketing team perhaps. She asks, our LDAT area is very large. Is there a tool for using apps and social media platforms?
It's a good question. I can't answer. Well, the first one in terms of areas, that's a little bit dependent on. We have a range of LDATs in terms of some will be very small, just localised LGAs, and some of them, considering the way that the country's laid out, there may be 400 kilometres between one partner and another partner, and there's multiple ways that those communities can be a part of one LDAT. And second part of the question, Laura, was?
Is there a tool for using apps and social media platforms?
Yes. So one of the toolkits that is in development is actually going to be looking at evidence-informed or ways that digital platforms or apps may be appropriate in terms of delivering health promotion messages. Yes, it's in development. Great. Thanks, Al.
Okay, thanks, Melinda.
Thanks.
Excellent. See you all next time.